Welcome to the France 24 debate, Hard Times for Students in this COVID pandemic. Tonight we're discussing the impact of the lockdown on their education, but also on their health. There's been a large demonstration in Paris this Tuesday, students calling for access to their campuses and a more normal type of educational experience. Many have been kept away from lectures since March. We're examining the impact this is having on them. Also, we're looking at the wider issues across the field of education. France is our focus, but the questions, of course, are relevant worldwide, where all students, teachers, lecturers and pupils are facing the same challenges, overcoming hard times under threat from COVID-19. Our guests for part one of this debate are Alison Pollock, Professor of Public Health at the University of Newcastle. And our second guest is a student, Sébastien Moses, a Canadian student here at Sciences Po in Paris. First, this report.
A friendly voice for those struggling to cope.
Oui. Allô, bonsoir, Nightline, je t'écoute. Oui.
With classes and lectures moved online, the pandemic's taking its toll on France's students. Nightline's young volunteers are on hand to listen, to offer support and advice, but never judgment.
There are so many different reasons why people call us, but the same themes keep coming up. Loneliness, stress, worries about their education, young people's friendships, love lives and family lives. But now with COVID, well, all the measures and restrictions associated with that are coming up all the time.
Cruz is another organisation reaching out to help. They introduced COVID counsellors in halls of residence, students who are paid to ensure the welfare of their peers.
We're a reference point for the students. If they have a problem, they can come and see us. As students ourselves, we're closer to them. It's easier to talk to your neighbors than it is to university staff. There's also a social side to our role, meeting our fellow students, talking to them, and getting to know them.
With COVID upending the norms of student life, access to qualified psychological support is also being expanded. As President Macron put it last year, 2020 is a tough time to be 20.
Chris Moore and the team with that report. Let's bring in our guests now here for this debate. We have Alison Pollock, Professor in Public Health at Newcastle, and our second guest, a student, Sébastien Moses, who is originally from Canada, but at Sciences Po here in Paris. Sébastien, I will start with you. Our report there giving us a little insight into how students are feeling. Tell us your thoughts right now. How are you right now?
Well, actually, I'm doing good. I'm in a special situation because I'm a foreign student and I live in a student housing. So for the social aspect, actually, I'm surrounded by people, which is actually pretty good for your mental health. But I still have to deal with the whole studying at a distance, Zoom, and the lack of motivations. And I can clearly see in my surroundings, people have clear depression issues and things like that too. But in my end, I'm still doing fine. Thank you.
Well, listen, first off, I'll just say I'm glad that you're doing fine. I'm glad you've got support around you and I'm glad you're feeling okay. But you've already identified the issues that many people are talking about, this one of depression, which is kicking in. What kind of things are you seeing among your friends?
Well, I mean, a lot of people are feeling lonely. A lot of people are isolated. I think mainly of French students that took an apartment in Paris, let's say, and cannot go out and blow steam off with their friends, something like that. They feel very isolated, no contact and interaction with their teachers either, which makes motivation for school extremely harder. So I'd say a lot of people are feeling extremely depressed and are very worried about the future of their studies, actually.
And it's one of these things about student life, isn't it? I mean, I'm thinking back a long way for myself, and I can remember there was the work hard aspect and the play hard aspect. And of course, you seem to have had, in many ways, both of those taken away because there's no sort of group study, there's no sort of exchange in that way. And of course, as you just pointed out, you can't go out and let off steam.
Absolutely. And more than that, it's also the fact that there's no more separation between the place where you study and the place where you live, which basically is the same thing for everybody who works at home from now. But the lack of that separation to have two clear spaces where you do different type of activities kind of mixed up everything for people and makes it harder indeed to blow steam off and just to relax and let let things go, I'd say. Yeah.
Sebastian, stay with us. I'll get back to you in a moment. Let's bring in Alison Pollock now, Public Health Professor at Newcastle in the northeast of England. Alison, thanks for being with us. You've heard what Sebastian had to say. I mean, clearly, no one saw COVID-19 coming. That's one of the things you have to say here and now, because it is a major emergency, and obviously how we cope with that is having a side effect on everybody, isn't it? But in terms of how students are and how their health is, what are your concerns?
Well, I think they're all the concerns that are shared by Sebastian and your early viewing. I mean, I think it's a really, really difficult time. And if you remember, children and young people are least at risk of contracting of being hospitalized and of serious illness and death. So they really are in the low risk groups. And yet they're having to carry an enormous burden of responsibility, which they've been extraordinary about. I think the students have been absolutely extraordinary. And I think in the UK, we also have our students facing financial hardship because, as you know, they have to pay fees for higher education, very expensive. And on top of that, they have to pay living costs. Very few students have any other kind of financial support. So many of them had occupations like waitresses or delivery people. And of course, all those jobs have gone now or they're decreased. So it's really, really hard on students in all sorts of ways. They're suffering financial hardship, loneliness, isolation. And I think they've been quite extraordinary. And the students, we do a lot of Zooms with the students. We've gone completely online, except for the medical students who do clinical placements. So those who are doing clinical attachments, dental and medical. But we've really gone online, and the students have been quite extraordinary in how they've responded. But as Sebastian says, it's a really tragic because there's no separation. They're in their bedrooms, Skyping and living all day long. So this has got both short and long-term consequences that I don't think we've yet realised what the impact is on this generation. And of course, they're going to be facing real economic hardship now, but also in the next few years as the economy starts to recover. So this is a very anxious time for them. And I have enormous sympathy for them. And I think they've been quite extraordinary. But of course, our international students, the foreign students, are suffering most.
Indeed, they're the ones who are isolated. Sebastian, in many ways, Alison, I think is lucky. He's pointed that at himself. He's in a house with other people around him and he's getting support. It's not the case for all students, though, is it, Alison?
No, absolutely not, especially some of the postgraduate students that have just arrived, either to do a master's degree or a PhD. And there's no way that Zoom can make up for that social interaction and that loneliness. And one of the things that we haven't done enough of is we haven't thought about the students and the rights of children nearly enough. Universities are doing their best, but they're struggling to cope. But I think we need much more action and input, not just around students in university, but also students in school, because unlike France, our school children, we have complete lockdown. All our schools are closed. And this seems to me extraordinary that we have no regional openings, at least for primary schools, because we know that young children are not major drivers of transmission. So we have really some big differences between how France is responding and how the UK is responding to this pandemic and the high number of cases.
Indeed. You said the students have been great. My own daughter's a student in the UK. She's at music school in London. She's struggling to get things through. I understand completely what you're saying about the cost, about the financial burden, and about the problems that they're having, and she's certainly identified that to me. Back to Sebastian at Sciences Po here in Paris. Sebastian is originally from Canada. And thanks again, Sebastian, for being with us, because we really appreciate having your first-hand telling of this particular story, of which you are at the centre. How do you feel about the idea of having a lockdown? Do you see the reasons for it? Do you think it's exaggerated?
Oh, my God. I don't know what I think anymore about that, to be quite frank. I mean, I understand the greater good, the necessity for another lockdown, but at the same time, I'm starting to wonder if the cost of another lockdown might be heavier than the benefit, especially when we speak about like mental health and just the social aspect of things. At some point, I'm not sure another confinement will pass in the public opinion. I think it would be very badly received. But still, I mean, I understand we have to do what's necessary to get through that crisis, but I'm wondering if the cost might not be too high.
And the cost for your student colleagues,
Yes.
I get the sense from yourself that things are fairly buoyant. I get the sense about what you're saying about your friends around you, that feels the same too, which is a good thing. But you don't have to look very far to find examples of students who snapped. I mean, we've had attempted suicides, we've had all sorts of things happening. Is there a fear that you share with your friends there that this is something that might become more common?
Well, yes and no. Like I said, because I'm surrounded by close people that we all live together, it's not that bad in my close surrounding, but people I go to school with, I can clearly see that a lot of people have the mixed pressure of social isolation plus the financial problems. They lost their jobs, their student jobs. So the stress is becoming pretty heavy. And if you add over that another confinement, totally, yeah, I can see where people could snap, totally.
Indeed, and as you say, Sebastian, these jobs, the small jobs, though, working as a waiter or a waitress, or maybe sort of working as an extra in the shop or doing some other small, low-paid kind of job really helps students mostly to get things done. Bar work, of course, something that is very common for students to do. Most of the bars here haven't been open, of course, in getting on for a year in Paris. Let's bring Alison back in from Newcastle University. Alison, I'm wondering what your feeling is about the lockdown, because obviously public health is your domain. You deal with that. I imagine you see the pluses and the negatives about locking down again, if possible.
Yeah, the real issue is our hospital capacity, especially in London. So we've had very high number of cases, and the government has been very anxious because our hospitals are very full and our intensive care units. So the real reason for the lockdown is try and slow or stop transmission so that the hospitals are not overwhelmed. But the good thing is that the number of cases are beginning to fall, and we do have a vaccination program. So I think everybody is very hopeful that we may not have a third wave, but we may. But I agree with Sebastian. The harms and benefits of this lockdown have not been properly considered. And I think one of the big issues is that early in the pandemic, our government responded too late and not enough. And over the summer, when it had a really good opportunity to put in a lot of safety measures, especially in schools, it failed to do so. So I completely agree with Sebastian. We need to have a really good conversation about the harms, the benefits, the costs, and we probably need to have much more regional relaxation of these measures as the cases fall, because that's one of the things that we haven't been doing in the UK. We have a very centralised system which is not locally responsive. So it may be that in some areas a lockdown is appropriate, but it's a very blunt and very harmful tool. So it's a tool that you really should avoid at all costs and show that you're taking all necessary measures. And we do have to remember that students and young children are least at risk in this epidemic. So we have to think about how we can get them back to university and how they can have some face-to-face contact as they did last term.
Indeed, you mentioned that young people are less at risk. Is there also the possibility that young people can carry that disease in some way to others? Is that obviously part of what might be in the thinking of people, of the government, when they lock down a country?
Yes, I mean, what the government is worried about is the risks of transmission to each other, because the risks of the illness being severe are less severe. And indeed, when the students went back, we saw an increase in cases in young people. They're much more worried about the transmission into the wider community, into the town. But of course, some universities, the students are quite socially isolated. They're quite bubbled anyway in student groups. So there's not quite as much mixing. And one of the problems is when students go back, we know that most of the transmission just now is household transmission. It's not even at work, it's households. And so there'll be much more mixing with older generations when students are at home anyway. So all of these things need to be thought about and monitored carefully. But one of the big issues that we're facing at the moment is the government is doing mass testing of universities with having had no evaluation at all of whether this mass testing is useful or whether it's harmful or whether it's beneficial. And the most important message for students is if you have symptoms, stay at home and try and stay at home with your household group and don't go out and mix for that period. The most important thing is to try and react if you have any symptoms. But otherwise, I think it's really important that as the cases fall, this government moves very quickly to make sure that schools go back and then universities get back.
Boris Johnson's taken full responsibility for the now more than 100,000 deaths in the UK, Alison. How would you respond to that?
Well, clearly there's going to be a major public inquiry into this because the UK has done so many things badly. We responded very late to the pandemic. We have centralised the response and privatised the response, so we're wasting billions of pounds, and we have not focused our efforts on rebuilding the public health capacity, the primary care capacity, and the hospital capacity. And we did not focus our efforts on making sure that our children could go back to school and our students go back to universities. So we are in a really terrible period at the moment. There will obviously be a major public inquiry. There are inquiries going on at the moment in Parliament. But of course, this is still early day. We're not at the end of this pandemic.
Indeed. There's still a way to go, isn't there, Alison? Thank you, Dr. Pollock. Thank you very much indeed. A final quick comment from Sebastian Moses, student at Sciences Po. Sebastian, clearly you've shared with us how you feel. What are you hoping for going forward? This is the time when I wish that I could actually read lips because we've had a problem with the sound. Sebastian is talking very, very fluently, as he has been, about the situation. But I can only think that he's hoping for a quick resolution to this problem, fewer deaths, no confinement, but obviously trying to sort of take the precautions as recommended by Dr. Pollock there from Newcastle University. That wraps up this first part of the France 24 debate. Stay with us. 2 new guests to come. Welcome back to the France 24 debate. We're discussing the plight of students during this COVID pandemic, and we're meeting our next guests after this report by Catherine Kedder-Clifford.
Marching towards the Education Ministry, French teachers vented their anger over working conditions, describing a lack of respect for sanitary conditions in schools and a lack of replacements for staff on sick leave.
En ce moment, on a besoin d'être ensemble, d'être solidaires, de s'épauler, de s'entraider. Et ils nous lâchent complètement. Mais on est des bonnes âmes, on fait quand même notre boulot, on est content de le faire.
On perd tous des moyens en fait. Il n'y a pas que les professeurs, les heures d'enseignement classe face à élèves en fait. Tout le monde est impacté là. Tout le monde va subir en fait la casse. C'est à la rentrée prochaine des heures en moins. Donc ça a des impacts sur la vie scolaire, sur tout le cadre de l'établissement.
The teachers' main demand is for a pay rise. Junior level French teachers earn 7% less than those in other OECD developed countries. School nurses were also among the crowd. They say they're feeling the strain as the task of carrying out testing and tracing leaves them spread too thin to support struggling students.
Ça surajoute du travail aux missions qu'on a déjà habituellement, où en temps normal on a déjà 18 millions de consultations annuelles. Donc c'est pas rien pour 7000 infirmières.
Meanwhile, university students latched on to the teachers' protest, demanding a return to full face-to-face teaching for all students, as well as financial support. Isolated and struggling, a government study found 50% of students in France were worried about their mental health, while around 23% said they'd thought about suicide. Students received some gestures from the government last week. First years were allowed to return to class in half groups, and the French president announced daily €1 meals for students in university canteens. But the students say it's not enough, as many aren't on campus to benefit from the meals. There was concern over the protests as COVID cases continue to rise in France, but the crowds were smaller than expected. The Education Ministry said some 11% of teachers striked across the country.
Kathy Kedder-Clifford with that roundup. Our guest for part two of this debate, Gabrielle Latanzio, is an English teacher at Lycée Paul Robert here in Paris. Thanks for joining us. And Professor Sir Gary Cooper from Manchester Business School joins us too. I remember you, Professor Cooper, before you got the knighthood. Well deserved. Congratulations to you, sir. May I start with you, please? We heard in the report that 23% of French students say they've contemplated suicide. First off, how alarming do you find such a statistic?
I find it very alarming. I think really there are mental health issues. If you think about students in general during the pandemic, number one, they're isolated away. Either, by the way, they're at home or with their parents and being taught online, or they're in a hall of residence or a flat somewhere in a city, and again, being taught online. So the social contacts are kind of primitive. But I think also quite a lot of students throughout Europe, and not just in the UK, work as well now to support themselves. And they usually work in restaurants and the hospitality industry, and they're not able to work. So they have financial worries as well. Then you have the students as well who, aside from just being taught online, which is not really the best. I mean, it's fine if it was a mixed model approach where you had some FaceTime, i.e. with other students in a classroom, and part of it was online, which I think will be the future model anyway. But if you don't have any money and say you're in a final year of your university, how about a job? And so there's stress there. Will I get a job? The likelihood is we're going into a massive recession. Will they be able to get jobs? Highly unlikely they'll be able to get jobs, although I think employers have a role to play here. And in my view, employers should be taking on students, graduate students, even if they're only taking them on part-time, a day, 2, 3 days a week, in some role, because what we don't need is a whole generation of university and college students who actually don't get employed for another year or two. So, and they can't even travel to learn from the traveling and the cultures and everything else because there's no traveling going on. So they're kind of stuck at home. And I think that's another worry. So it's financial worry, it's the lack of social contact, it's all of that. And, the stress and strains on students pre-COVID was a problem. Mental health among students has always been a problem, but now it's been magnified.
Indeed, it's a big change going from home to higher education. And like you say, so many challenges there, and all this made 10, 20 times as worse because of the COVID-19 pandemic and all the things that go with that. Professor Cooper, thanks for the moment. Let's bring in Gabrielle, who is a teacher at Les Lilas, not Paris, as I said. And there is an important distinction between those two. Gabrielle, of course, you've been on our programme on this channel talking about the challenges that you face in teaching children about secularism, particularly in the wake of what's happened with attacks in Paris, and particularly the attack on a teacher in the northwest of the capital, which we spoke out at length, Samuel Paty, a very tragic story. Of course, this discussion looks at how you're coping with telling your children about COVID-19, if indeed you have any dealings with them. I mean, tell us about your daily life now and how it's changed in your job.
Since September, very little, in truth. Ask the question at different times and you will get different answers. At the moment, I and my students all believe we need to tighten our control over the pandemic, because the reality of our everyday life is we are doing just as we were doing in previous months. We are teaching, but we have half the students we're supposed to be with. That's the one change we have. I'll tell you one thing. You said just now there's a difference between the way schools are handling the pandemic in Paris and in Les Lilas. I appreciate that precision because the truth is the way high schools manage it is different, and it is down to local decisions. Where I am, because we've been hit by the pandemic really hard in March and April, I've lost a colleague, a Méziane, a math teacher. Some of my students have lost their parents in March and in April. We are very aware of the emotional consequences, not just of lockdown, but of no lockdown. It can be really tragic, and it hits close to home, right? So we have decided to divide up by 2 the number of students that can be present at any time. Some schools have not made that decision. So what does that mean? That means in some places, we are the ones sacrificing social interaction, quality of education, in order for the nation to protect itself a little bit more. And I believe this is the one injustice that I'm most concerned with at this very moment. I believe all high schools should follow the same protocol, which is half of students at all times, and so we have a better control over the pandemic.
It's important to have face-to-face contact. It's face-to-face teaching, should I say, and that distance contact, nonetheless, contact and a sense of the humanity of it all. Is that what you're saying, Gabrielle?
I also agree with that sentiment. Now, when the situation gets too critical, there's no other choice but to go on Skype, Discord, whatever, and talk to your students that way. Now, you talk about the importance of being face-to-face with students. Yes, it is true. I'll tell you an anecdote that I was thinking of as I was preparing to talk to you. Some of my ex-students have been hanging around the high school where I work at because they are missing that social interaction. They are now students at universities, but they don't have any meeting there. So what they do is they show up at the exit of the high school where I work at, and they come talk to us for a few minutes, just so that something's happening besides their Zoom calls with teachers.
So you in effect are kind of filling a gap, a psychological gap there. Gabrielle, thank you for the moment. Let's go back to Professor Cooper. That aspect that Gabrielle's talking about, Professor Cooper, about trying to fill some sort of a gap there in the students' lives. I mean, clearly this is something that is a massive need, I suppose, to sort of create these touchstones that students can go to get, it may be reassurance, it may be guidance, but some kind of sense of belonging in a way.
Absolutely. By the way, this applies to all students, primary, secondary, university students. What they're missing is the social contact. The content they can always catch up on. But the social content, we learn as we're growing up in secondary school, even in university, we're developing ourselves through our social relationships. And missing that is what everybody's missing. By the way, us adults who are working are doing the same thing. We're missing it. The teachers are missing it. The university staff are missing it, which is contact with their colleagues. And this has been going on for quite a long time now, 10, 11 months, off and on, well, mostly off. And therefore, we've got, this social contact, I think, is fundamental to people's health and well-being in general terms. And now that we're all in many countries locked down in one form or another, we talk about social distancing, but that's not the construct we should be talking about. Physical distancing, yes, but social connectedness is really important. We've got to find ways of doing that, I think. It's important for the kids, whether they're primary, secondary school kids or university kids, to link up, because this is what is troubling me.
Professor Cooper, we spoke in part one with a Canadian student here in Paris at the prestigious Sciences Po institution, who was talking about the fact that he's got friends around him is helping a great deal. So they're in a bubble in their own student accommodation, and he says he's getting on okay. But nonetheless, the next sentence then revealed fears that people are considering harming themselves, feeling isolated, and basically feeling lost. I'm wondering what you've observed from your professional perspective, because a lot of your work is about observing and looking at how people behave and understanding that. What have you been observing, Professor Cooper?
Well, I think probably he's right. What a lot of students are is they're in a hall of residence now, or they're in a flat with other students. And that's great for a month or two or a few weeks. when it drags on, then relationships begin to fray a bit. And, normally students are interacting with a whole range of people, their professors, their lecturers, other students they meet who are not doing the course they're doing, etc., and working at the same time to earn some money. And they're not getting much of that. It's all kind of very, very constrained. And by the way, there are students who are missing their family and obviously can't get home because, in many countries you're prevented from traveling. So I think really, I think we all know this. By the way, this applies to adults as well. A lot of staff are feeling kind of low because they're missing the context they have as well. But, I think we just have to watch the difference between an employed person like a teacher, a lecturer, somebody in the private sector is probably their line manager has been told, please get in touch with them one-to-one. I guess we need more of that in schools and in universities where we are in contact with all our students on a regular basis, having tutors make sure that they are in contact with them, because I think that's important to be able to identify a student who has either unmanageable workloads, has a mental health problem, is getting a bit depressed or a bit anxious, and then trying to find help for them. And we do have help. Universities, and I don't know about schools so much, but universities at least have counseling services available for students, and make sure if you see a student who's having problems, you have to get them in touch with the counseling service, which they're doing now virtually online as well.
Indeed. That very issue I was reading earlier, it was something like one counsellor per 1,500 students in the US. And at a university here in France, it was 1 per 30,000. Clearly, different countries, different priorities, different budgets, different reasonings, I suppose. Professor Cooper, thank you. Please stay with us. Let's go back to Gabrielle Latansier, who's an English teacher at Les Lilas, just outside Paris. Gabrielle, listening to Professor Cooper there talking, I'm kind of wondering whether you were feeling that kind of pressure that he's talking about. Because in a sense, you're trying to be almost an extra parent to some of your pupils, I imagine.
To some extent, yes, but I'm not one to talk about my own emotions in that way. What I could tell you about teachers is that they feel like they do a lot. They feel that like they've had to adapt to complicated situations. They've had to learn a new job in some way, and there's a lot of responsibility that comes to the job that is not quite appreciated. As you know, today many of us were on strikes, were striking, and this speaks to where the profession is at. I've been teaching for around 12 years now. What I've noticed is that most of my colleagues have chosen that profession because of its meaning, because they're looking for a purpose. And what teachers are saying in the current context is enough with the exploitation of our own professionalism, if you'd like, right? Now, I would never call myself an extra parent for kids, but believe me, when it comes to the psychological well-being of students, yes, there's a little bit of that, and I try my best to make the youth understand that there are different roles for different people in their lives. Now, the truth is, I think there's something critical happening right now with the pandemic, but I would argue that for the past 5 years, I think the psychological situation of the youth is getting worse. I think it's social media is not helping, distancing is not helping, and we need to be really, really careful as to what's going to happen. We need to get out of crisis management mode and think about what kind of public services we want to give our youth. And it's not just instruction, and I think that's where you're getting at with your question. Your question was, are you an extra parent? Well, I feel like parents are overloaded with work. I feel like teachers are too, so we might need to think of a new sort of public service for kids. And I think it's got to be psychological in truth. We need public intervention in the field of child psychology.
Gabrielle, you got straight to what I was trying to get at with my question, and you understood completely. As ever, you're perceptive. Let's bring in Professor Cooper, another very perceptive man as well, to get more comment on that one. Is that where there's a gap, do you think, Professor Cooper? People are teaching, in a sense, on all levels, needs to provide that. Go ahead, sir.
Oh, absolutely. I think we need more educational psychologists around. We need, kids to be able to have access for counseling if they need it. And there are countries, and there are educational systems that do provide it, but it's still woeful. By the way, mental health is fairly woeful. In most countries in Europe, we don't have the capacity and to help people with mental health problems. We just don't have the counselors. The numbers are puny. They're really weak. There's no parity between physical and mental health. And mental health probably accounts in the most developed countries in Western Europe to about 40% of the morbidity. And yet we only have about 10% of the resources, the counselors and talking therapies available. And when it comes to kids, we certainly need that. We certainly don't have enough in most Western European countries. Very important that we think about this in the future. We should have thought about it in the past. This is not just a COVID issue. This has been an issue we've had for a long time. COVID had just made it a really important issue now. How are we going to look after the kids? Even in universities, we do have counselors. We don't have as many as we probably need, most universities. And so we have to rethink this as a society. Do we have the right mental health resources for people? I mean, if last year in the UK, pre-COVID, 57% of all the workplace absences, 57% were for what we call the common mental disorders of stress, anxiety, and depression, the biggest single source of sickness absence in the workplace. And think about kids. They're suffering. They always have suffered. And we just don't have the resources for them, but we're going to have to get it, and we're going to have to reconfigure it in Europe.
It's leading to a redefinition of society, a redefinition of education. Gabrielle, is that the issue? Things are just too results focused. There's no real sort of taking into account of how children's minds are developing.
Yes. What I appreciate with the way you have framed that debate is that you ask the question of the interests and the well-being of the youth first. And I don't think that's what we've been doing in recent months. What we have been saying is, here's the global situation, here's what's necessary, and who's going to compromise, who's going to sacrifice some of his or her life to make things better. What you're saying is we need to be especially preoccupied with what the kids are going through. And look, this is a story that we've told time and time again in different contexts. Young generations fight wars, not the old, not the middle-aged people. Young generations fight wars. I'm not sure about the validity or how good that analogy is when it comes to saying we're fighting a war right now. I know our president has done it quite a bit, but still, what we do know is that time and time again, it is the youth who make sacrifices. And we need to think long-term how to give back. And it takes many shapes and forms. Improving our school is one way, and I believe it's not one sector of our society that should come after. Some people are saying, look, it's difficult for the private sector. People are losing their job, so we can't spend more when it comes to what we give to kids with schools. Well, I disagree respectfully. I believe it should be the priority. Why? Because putting money into children is an investment. It's for their well-being, and it's for the greater good, in truth.
Indeed. Hear, hear. Professor Cooper, this will be your final comment. Boris Johnson's just taken responsibility for 100,000 deaths in the UK, says he's to blame. Well, that's as far as the UK Prime Minister's put it. If there's another national lockdown happens in the UK, would you be in favour of that, or would you think they should find a different solution, different way of doing it?
Be in favour of what? Another lockdown, you mean?
Yes.
Is that what you're saying?
Yes.
Listen, public health has to be number one. I'm afraid that's the most important thing we have to do. We have to look after our health. We have to get on top of this. Luckily, in the UK, we have a vaccine. It's being distributed pretty rapidly. And I think that's really good news. I think the strategy hasn't been good here, and hasn't been good in a number of countries, but certainly in the UK, it hasn't been good. The figures are there to tell you it hasn't been good. And so we have to look at it and see what we did wrong. And we did do things wrong here strategically, and they have to be sorted out and for the future, because guess what? We're going to be living with pandemics from now on. The good news is the pharmaceutical industry will be on top of it. They have platforms already, but we have to manage this. We have to manage our public health in a better way. And we need leaders who kind of understand that and will take swift decisions when they're needed. And sometimes they're tough decisions, but they need to be taken.
Professor Cooper, thank you very much indeed for your time, sir. Always appreciate it. Thank you to Gabriel Latanzio from Les Lilas, just outside Paris, where he is a teacher. Thank you both for joining us here on this debate. And thanks to you at home or wherever you are for watching. Stay with us. More to come here on France 24.